Thank you for joining me on this video where I interview the medical director at Fasting Escape, Dr. Renae Thomas, where she will talk about the ins and outs of fasting. Have you ever fasted or know someone who has? Let us know in the comments below. We would love to hear the story, and you never know how you may inspire others. And now, on to the video. For those who don't know about you, tell me about who you are and what you do.
Sure. My name is Dr. Renae Thomas. Thank you so much for having me. I'm actually an Australian, but I do live in the United States, and I am a triple board certified physician in family medicine, general preventive medicine, and public health and lifestyle medicine. I work as the medical director of Fasting Escape, where we help patients to achieve their healthiest and happiest selves.
Wonderful. I like that. Healthiest and happiest selves. Got to say, one thing that I've been really focused on, I got to say within the last year or 2 years, is finding that joy in my own life. I mean, it's been a big deal for me, and I push that as much as possible. So I really appreciate that. Absolutely.
Absolutely.
So when and how did you discover fasting?
Absolutely. So my story actually goes really far back. And I always kind of share this when I talk about it because I think it's relevant to how I got into doing the type of medicine that I practice.
Okay.
So when I was really young, my dad actually had metastatic cancer, and he had it in very young in his life. He wasn't even 40 years old. And metastatic cancer is cancer that's spread to distant parts of the body beyond your primary cancer. At that point, people say things like stage 4, or it's usually quite severe cancer. He did have normal medical therapy, but he knew there had to be more, and he really wanted to prevent any recurrences in the future, which is very common when people have cancer. 5, 10 years later, they either have another cancer or their previous cancer comes back. He was like, if I'm going to do this, I'm going to do this properly. And he also didn't have the greatest prognosis, so was also looking for other options. And he discovered nutritional changes and fasting. He did a lot of juice fasting through his cancer treatment, obviously with the support of his doctors, and then transitioned to a fully plant-based nutritional lifestyle. And that's how I was raised. Like I said, I was very young at the time, so I don't really have any memory predating this. And
Okay.
so he raised me with a very strong focus on nutrition as medicine, your lifestyle, physical activity. All of these things are how you be a healthy, happy human. And mindset, of course, is a big part of it too. But that was my first introduction to fasting, because my dad was drinking, countless jugs of celery and cucumber and carrot juice. My dad actually changed his skin color to orange from drinking so much carrot juice, which
Oh, wow.
can actually happen. It's a real thing. There's certain people, certain genetics can make you more susceptible to it, but pretty much anyone will taint their skin orange after a while. So not necessarily the goal. But
Yeah.
he actually had, he's actually a bit of a medical miracle. He had complete remission of his cancer, and he has lived well ever since. So
That is,
to go from metastatic cancer to, now he's 30, I'm trying to think exactly how old my dad is, 35 plus years post cancer, and has lived in great health ever since. Obviously, he's continued on with the nutrition and health promoting practices, but that was really my first introduction to fasting. Um, when I was in medical school, some of the stress and things I was doing with my lifestyle, I was working full time while in medical school. That's a lot to do. I actually had a bit of health problems myself, nothing that could be, it was one of those things where, you go to the doctor and you're fine, but I didn't feel fine. And that's when I first
yeah.
started playing around with fasting myself and got really good benefits. One of the things that happened to me was I actually one day woke up and couldn't walk. It was very strange. I still to this day do not know medically what happened to me. I don't know if it was just complete cortisol exhaustion, and that's when I started playing around with things like fasting for myself. I didn't really know what I was doing. Most of what I was doing was things I read on the internet and didn't have a lot of experience, but what I did do helped me greatly. And I became more and more interested in it. And it actually coincided with the first year that I went to a conference in the United States for plant-based nutrition. I went to the Plant-Based Nutrition in Healthcare, or the Plantrition Project conference, and Dr. Alan Goldhammer of True North spoke that year. And I remember, I think I was a second year medical student, and he gave his talk, which is wonderful. And the one part that stood out to me was when they were talking about high blood pressure or hypertension. And it's a case series, sorry. So sequential cases of improvement on high blood pressure. It's published, it's out there for anyone to read. And those results stood out to me because they're more significant than what you would see in patients taking multiple blood pressure medications. Just the results were beyond what I'd ever seen. And I also had never heard of a lot of water fasting until that point. I'd heard of juice
Okay.
fasting, you know, maybe 1 or 2 days on water, but not 20, 30, 40 days on water. And it sounded dangerous. And I was so intrigued,
Right.
but I was so intrigued because I was like, if you could just, you know, what, how are you getting these results? And he just had results after results after results, and so clearly documented in ways that, you know, your scientific medical brain, I was like, this isn't just, you know, some out there thing. This is real medicine. And so that had coincided at a time where I actually had an elective in my medical school where we could go overseas or we could go anywhere we wanted to
Okay.
learn, you know, a different modality of medicine. And so I reached out and I was like, I have to go to True North. And I was able to get, so we had to have a medical doctor supervise us. And that's when Dr. Clapper was still there. And so Dr. Clapper kind of came on as my doctor mentor, and he supervised me while I was at True North. And I did their standard internship where you go in and you work full time as their medical intern. And it was just an absolute life-changing experience for me in terms of medical career. It was the first time I really saw in clinical practice beyond my dad the benefits of fasting and the transition to that health promoting diet on so many different conditions. And I was sold. I didn't want to leave. I didn't want to go back and finish medical school. I wanted him to hire me on the spot. So I just was so fascinated by everything that I had learned and seen, and how much I enjoyed seeing people get well. And that's really why that really got me hooked on the benefits of medically supervised fasting, and why I've continued on that journey ever since.
Absolutely, and that's incredible. I mean, your path in getting to the point where you are now is amazing within itself. I mean, thinking about what was going on with your dad, and then
Mhm.
moving on into some of the complications that you have, that you have no idea what was going on. I can't even imagine what it must have felt like to wake up and not be able to move.
It was so scary. It was so
Yeah,
scary. Fortunately, I got well really fast, but I don't know what I would have done if I didn't know about these other modalities, because that's the only thing I can think of that helped me. Because, you know, I was going to doctors and they had no idea what was happening. So it was very scary. It was fortunately, like I said, very short lived. I've made a full recovery. Obviously, I can walk and do everything now, but very intense, scary period of my life. That's for sure.
absolutely. So this is probably a bit of a no-brainer for anyone watching this, but do you still fast? Why or why not?
Yeah, you know, I don't fast as much as I probably should, and I certainly haven't done any prolonged fasting. And so, you know, that period when I was ill was the longest I've ever fasted, but it was mostly modified fasting. I've always been a very small, slim person, and so I simply just don't have the reserves to be able to do. I've never done a 20, 30, 40-day water fast, nor do I anticipate myself ever being able to. I mean, you typically lose half to a pound per day. I certainly don't have 30 pounds to lose, and I'm very grateful for that, but it does mean that I don't do prolonged fasting. Times that I still fast, if I'm ever sick, it's very important for me. I pretty much lose my appetite when I'm sick anyway, but I think that fasting when ill, not that that's common for me to get ill, but if I do happen to get ill, working in a hospital used to make me ill more often. Those times I would fast. I try to do a short period at least once a year. I think that's important for health and longevity. You know, like a quick 3 to 5 day or something like that, I think is really important. And it would be something that I would definitely consider if anything, you know, hopefully not, but if anything were to happen to me, that would probably be my first go-to really kind of ramp it up and step it up. But yeah, try to do kind of a maintenance fast every year, but I probably should do it more like quarterly. I just it's hard for me because I stick to the health promoting diet. I stick to the
Yeah,
healthy living, and I feel great. So my motivation to fast is lower than others, but I know that I should probably do it a little more often. And probably as I start to notice some effects of aging, I'll start to do it a little more often for those
right,
benefits too. You know, when the joints get a bit creaky or something starts going on,
right.
I'll probably start to do it more than I do now. But at the moment, I feel very lucky that I live in good health. And so my motivation to fast is much less.
I understand that. I started fasting July 31st,
Hmm.
2021. So it's been a solid year now, pretty much.
Wonderful.
And notice that now I'm less likely to fast because I actually, when I started, it was more continuous, like a every month or moon cycle kind of
Oh,
thing, if you want to
wow.
say.
Very cool.
Yeah. So I noticed that. Well, first off, my taste buds, they it's like everything became 10 times more heightened
Yeah.
than it ever was. So I
Hmm.
got to say that that's something I was appreciative of. Plus a whole lot of other benefits, but we'll be getting into that very soon. So let's
Yeah,
go.
you're so right. You're so right. The taste bud thing I think is really important because that's one of the things that because I maintain the health promoting diet, I don't eat those kind of hyper palatable foods that I don't have that need to go to fasting to reset the taste buds because I simply don't have those foods really in my diet. So it's much easier to stick to the nutrition as
I
well. So
understand.
I completely resonate with what you're saying.
So what is
Sure.
fasting? Who do you recommend? And who do you not?
Absolutely. So fasting at the simplest definition is really your absence of all food and beverages. And a lot of people do ask that question, like absolutely nothing to eat or drink. Well, we have pure water, the purest water that that you have access to, and you need to drink a substantial amount of water while you're fasting. But it is the absence of everything else. It's usually done for therapeutic or religious purposes, and here we're going to focus on obviously the medical or therapeutical reasons. The religious is not in my realm of expertise, but that is another reason that a lot of people do fasting. The
Mm,
biggest thing that I like to clarify is the difference between fasting and starving, because sometimes people use those interchangeable or don't understand the difference because people would think if they go without food or drink, they're starving. When in fact, the first stage of going without food or drink is your fasted stage. And that's when you still have non essential tissue that your body can utilize for energy. Once those reserves run too low or you exhaust them, that's when you transition into starving. And that's why we only fast for certain periods of time. And we always make sure the body is able to handle it physiologically, because the last thing we want to do is starve someone. Fasting is a completely different modality. The second part of your question, who do I recommend to fast and who not? And I think the decision to fast is an individual one. And I think that someone should always listen to lots of different experts in the field on all different modalities and put fasting in the context of all the other options that they have to reach their health goals. Fasting is not the only thing, it's not a magic cure, it's just another really effective treatment modality to put in the context of everything else. I certainly don't think that I'm here to convince anyone to fast because it isn't without risks and it does require close supervision for most people while they go through fasting, especially the longer duration ones. But if we're thinking who would benefit from fasting, the conditions that respond really well to fasting are those that are typically the chronic conditions that worsen with poor diet. So things like high blood pressure
mhm.
or hypertension, things like type 2 diabetes, those metabolic syndrome and metabolic conditions, things like high cholesterol. We see certain improvements with autoimmune diseases, a lot of the GI issues, even adjuvant cancer therapy. And I know that's something that's not talked about. A lot of people shy away from talking about cancer, but there is good research for adjuvant cancer therapy. And by adjuvant, I mean in conjunction, sorry, with your cancer treatment, having it as an additional modality. I don't recommend anyone do a fast that doesn't want to do a fast because, like I said, it is an investment. It's time. It's something that you really have to want to do and believe is going to work for you. Like all, it's kind of a joke in medicine, but we do have the placebo effect for a reason. You have to believe something's going to work for you. If you don't believe it's going to work, you probably won't enjoy it as much or see the results that we would expect. So that's kind of the main things
Yeah.
that we focus on there. In terms of who can't fast, always recommend doing medical pre-screening, and that's one of the things we really focus on to make sure someone is safe to fast. The contraindications are less than most people think, but the ones that we really highlight are people on medications that can't be stopped. So a type 1 diabetic is a perfect example. Significant heart issues, especially if they're unstable or certain arrhythmias, someone that's underweight or has an eating disorder, some of the severe anemias, porphyria, malnutrition, and then there are a couple of rare kind of inbuilt errors of metabolism. One of those is like an essential fatty acid inhibitor problem. Those things make it challenging to fast, but most of those are few and far between. So most people
Yeah.
can fast for short periods of time as well. And then that duration of longer fasting, that starts to be evaluated on a day-to-day basis, as someone's fasting to make sure they're still safe. Just because you were safe 5 days ago doesn't mean you're safe anymore. So that's kind of where that ongoing supervision comes in.
What are the benefits of fasting, short term and
Mhm.
long term?
Yeah, absolutely. So the benefits, this was surprising to me when I first learned this, but fasting has been actually published in the Lancet. I think the first one was in 1958 for autoimmune diseases, where they were looking at acute glomerular nephritis and improving the prognosis there. So this isn't a new or novel concept. In fact, when you read some really old medical books, we've got fasting back in the 1900s, 1800s. One of my favorite things to do is actually read really old medical books. Some of the things
Hey,
are
that's
scary,
good.
some of them are fascinating.
I bet.
Just seeing what was out there and what they were doing. But fasting is a long term medical procedure. So when we talk about short term benefits, kind of what we touched on. One of the biggest benefits is that facilitation to a health promoting diet. And that's really the key to keeping those long-term benefits. Like fasting isn't a magic treatment where you can just do a fast and then go back to your previous lifestyle and just carry on and maintain the results. It's not like an antibiotic or something, right? You have to continue the healthy lifestyle, but it is like a jump start. So a lot of people see really rapid improvements, and that it can be really motivating to then stay on the lifestyle to maintain those results. So that, the reset in the taste buds, as you mentioned, super, super beneficial here. Pretty much anything's going to taste good if you haven't eaten anything for 10 or 20 days.
Right.
I've never seen people enjoy zucchini as much as I did at True North. Like, it's like, oh, this is amazing. What did you guys do with this? It's like, it's literally just steamed zucchini. You just haven't eaten anything in a long time. But the taste buds do reset over time as well. And I think using that to your benefit is introducing those fruits and vegetables first and really avoiding those super highly palatable foods that are not health promoting, your high fat, high salt, high sugar, that really are almost drug-like in their effect. Once you eat those, no one wants broccoli. But if you only eat those health promoting foods, they tend to be very, very enjoyable, and it makes it much easier to stick to that nutritional plan. The other thing that we really see as the importance is reduction in inflammation, and it's usually pretty significant. So we see reductions in things like insulin and pro-inflammatory compounds in the body. We see reductions in ESR and CRP. Like I said, I'm not going to do acronyms. So what is that? Erythrocyte sedimentation rate and your C-reactive protein. These are very common markers of inflammation that get elevated in a lot of things like GI disorders or arthritis or autoimmune diseases. And we see pretty substantial reductions in those. We see increases in things like adiponectin and ghrelin, and that can help suppress inflammation. And that also helps improve insulin sensitivity. The more insulin resistance we have, the more inflamed we tend to be, and the more metabolic conditions and metabolic syndrome we tend to struggle with. Gut microbiome tends to rebalance out. And then in terms of, say, autoimmune disease or allergies, we do see reductions in antigen antibody complexes, increased immunoglobulin levels, and reductions in oxidative damage overall. Long-term benefits, that really depends on the person, right? And some of these are more theoretical and research-based because it can be very hard to see per se, sometimes these long effects. So what I mean by that is, how do I know that I'm giving you a longer life? How do I know that I'm reducing your risk of cancer? Because we don't have a control group or a comparison when it's within the same person. But theoretically, we do see things like lengthening of telomeres. So that relates to anti-aging. Our stem cell function declines with time, and it usually starts to become associated with pathology. So if we can slow or decrease that stem cell decline, the theory being we can reduce some of the illnesses that we tend to see that are age associated or associated with aging. There's hundreds of genetic and epigenetic changes that occur with fasting, things like increased autophagy and upregulation of DNA repair mechanisms that can happen with fasting. And of course, that's the first thing that it's really tempting to draw conclusions like fasting helps you live longer or fasting prevents cancer. We don't have that evidence, but we see the same mechanisms that we see in a lot of cellular studies that at least give us thought or hope that that may be that trajectory in humans. And that even can go as far as, towards some of those shutdown of cancer pathways. We see things like IGF-1, AKT, RAS, mTOR, and that can help downregulate some of the cell growth and proliferation. But again, just hard to know those long-term effects. A lot of these are cellular based, but lots of promising research, lots of individual success, but just not able to say that in an evidence-based manner just yet. Hopefully one day.
Gotcha. Absolutely. I definitely hope so. Because like I said, it's a lot of good benefits when it comes to fasting. Like I've heard so many, of the doctors that I've interviewed say, when it comes down to it, everyone fasts. It's just a matter of how long.
Yeah, that's so true. Unless you're snacking all night long, right? We all do have fasts. And that's what's so interesting with intermittent fasting when it comes up. And some people are like, oh, I fast 12 hours. I'm like, isn't that normal? Like, you're not supposed to eat all day long. Like 24 hours, it's not like an open buffet. Like, we got to stop eating sometime.
Exactly.
Absolutely.
How safe is it to exercise during a fast?
Exercise is not recommended, not the type of fasting that I supervise, that I'm experienced in. We really recommend limiting exercise as much as possible. And so you really want to be in a total state of rest or as close to that as possible. And from an immediate perspective, things like dizziness, lightheadedness, they're very common during fasting, especially that orthostatic. So when you're going from sitting to standing or lying to seated, you can feel quite lightheaded, and we don't want you to pass out or faint. And exercise is going to exacerbate that. You're also exercising when with no glycogen stores, so you risk hypoglycemia or low blood sugar. Again, fainting, passing out, things we don't want to happen. And you also start to deplete your electrolytes that while you're fasting, you're not replacing. And so you're going to end up shortening the duration that you can fast for by exercising. And we have had people, unfortunately, that have exercised against our recommendation, and they typically feel really slow and fatigued. And it's not giving the benefits of exercise because your body doesn't want to exercise while you're fasting. And afterwards, most of them feel awful. They usually need to break the fast shortly after. It's just not conducive to fasting. You're supposed to be resting and healing, not going out. And while exercise is beneficial, exercise is breaking down the body, right? So that's it. You're pushing your stress, you're pushing your body, and it's the complete opposite of what we want to do while we're fasting. Fasting, we want to rest and heal, save the exercise for when you're feeling well. I mean, some people are dying to take a short, light walk. Sure, if you can tolerate it, just keep close to your house in case anything happens. But that's about the maximum that I recommend for safety. And I typically recommend avoiding physical activity. You can do a bit of stretching or bed yoga or something if you want to, if you're feeling antsy, but exercise is really not something we recommend during fasting at all.
What things must be considered as a female versus a male when fasting?
Yeah, for sure. I mean, there's the very obvious, don't fast while pregnant. That's not something that I would recommend. Um, I don't see a huge difference between males and females per se. The differences tend to be more between individuals, right? So I mean, one of the ones we do see, men do tend to lose more weight per day, but that's common with most nutritional plans or diets, and it usually just reflects the fact that a male tends to be a larger size. They tend to have higher muscle mass and faster metabolic rate, so they do tend to lose more weight on a day-to-day basis. Women generally do have that higher body fat percentage. So you would think that they would have more stores and maybe be able to fast longer, but then they're generally smaller in size. So the percentage in terms of absolute terms of stores doesn't usually balance out there. One of the things I do see is menstrual irregularity sometimes with fasting. So it's not uncommon to see someone skip a menstrual cycle if it is due during that fasted period, but it usually doesn't have any negative long-term effects. In fact, it tends to have the opposite. We tend to see improvements in irregularities for people that are struggling. So something like PCOS, endometriosis tend to respond very well to fasting and the health promoting diet. But if you do happen to skip a period in the middle of a fast, that wouldn't be something that would be abnormal. In terms of them responding better or worse, honestly, I can't say I've really seen a difference between the sexes. I see both genders, both sexes respond extremely well to fasting. I can't say that I've seen a significant difference. I think that potentially something like autoimmune disease may be the difference because there is a lot of female predominance in autoimmune disease. And that's where we're talking a lot of susceptibility and sensitivities to food and lifestyle behaviors because there is that female predominance of autoimmune disease. But I think when we're looking truly at the individuals, I don't think there's a significant difference.
Okay, perfect. For someone who's actually interested in fasting,
Yep.
what words of inspiration would you give someone who is considering getting started?
Yeah, absolutely. I think a lot of people have tried a lot of other things, right? They're really trying to improve their health. They often feel like they've tried everything. Maybe they're not getting the support elsewhere. And it's kind of a bit of an extreme thing that they're thinking of doing. But there often comes with that a lot of fear. Is it dangerous? Is it going to help? Is it going to be an awful experience? What am I getting myself in for? And that can hold, fear is huge and fear holds a lot of people back. So often, with fasting, we know that when it's supervised, when it's done safety, the risks are pretty low. And so it's really just their fear holding them back. So we usually spend a lot of time in the medical pre-screening and, going through or ask me all your questions. Let's go through all of them. And really, we end up coming down to what have you got to lose? Just give it a try. If you do one day and it's awful, we stop. It's not like a permanent thing, right? You start fasting, you can actually stop it whenever you want. It's pretty easy. You just go get a glass of juice and you're done. Like it's over with. It's easy. It's fast. Or you may potentially benefit, and that's the goal. And, it's pretty low risk for a potentially very high reward. And so I usually just say, let's talk through all your fears. Let's see what we've got to lose. Have your backup plan, have your safety. Some people want to make sure someone's with them or, that they've got supervision or whatever that looks like for the person. And then just go for it. You can stop it whenever you want.
And that's perfect. I love that. So what do you recommend someone do when they're getting started with fasting?
Yeah, absolutely. So the first thing that I, partly because it's my job, but I really do recommend medical pre-screening. We want to make sure that there's no reason that this is going to be a danger to you, right? We want to go through your medical history, medication, supplements, life, what your job is, what you're planning on doing while you're fasting, all of your questions, all of your concerns, what does your lab work look like? Making sure that you're a really good candidate for fasting. So that's always the first part. Provided, you got the tick of okay, you're good to go, which most people do. I make it sound much more intense than it is. Most people are good to fast, but we just want to make sure you're not one of the few people that are not, so that we cause some harm or something like that. So once you
Right.
get the kind of a-okay medically to go ahead and fast, we typically do have people do a lead-in diet. And that really, the duration of that depends on how you were eating before. Some people come in, they're living on pizza and cheeseburgers and things. We don't want that to be, we don't want any of that to be in your gut while you're fasting, because again, this is kind of not a commonly talked about thing, but most people don't have a lot of bowel movements, if any, while they're fasting. And so we don't want, your cheeseburger kind of sitting and, I don't like to use things that we don't know are technically true. You hear people talk about, rotting in the colon and things. Not really a true thing, but we do know that people that eat those kinds of low fiber, highly processed foods before the fast can often have a lot of constipation and uncomfortable bowel movements as they start to reintroduce food. So we want to make sure the first at least kind of 2 to 5 days before you fast, you're eating high fiber, soft, easy to digest food. So mostly fruits and vegetables is the recommendation. They can be raw or steamed, whatever feels good for you, at least 2 to 5 days beforehand, so that we know everything's kind of moved through pretty fast. Your last bowel movements doesn't mean that anything's kind of stuck in there. And that usually leads for a much more successful refeeding process after the fast. And also, people tend to have less abdominal discomfort during the fast if we know that everything's kind of cleaned through nicely before they get started. So the lead-in diet is also really important for that part of it. And the other part that we have the medical pre-screening for is that you cannot, for the vast majority, almost all medications must be discontinued before fasting. And so
Okay.
you do need to work with a medical professional to come off those medications. I never recommend just stopping them. I would talk to someone, it can be hard to find a professional that's on board for doing so. So make sure you speak to someone that's familiar with fasting, that's able to taper you off any medications, or be honest with you, there's certain ones that can't be tapered and maybe you are or are not a candidate. A lot of the chronic ones, we can work towards getting you off that medication, but it may not be instant. Something like a blood pressure medication may take weeks to months to be able to wean you off them. And then at that point, you'll be safe to fast. So medications and the lead-in diet are probably, medical pre-screening, medications, lead-in diet would be kind of your top 3 things. And I think talking to a lot of people, talk to people that have fasted before, look at documentaries, read some books, get yourself educated, kind of know what you're in for before you do it, so that there's no kind of unexpected surprises or things like
Right.
that. And just kind of knowing what the experience is like. And I think also having that motivation, or at least the thought process of what you're hoping to achieve with your fast, and knowing that kind of going in can make it a lot easier to push through, some of the hunger in the beginning, or the tiredness or lightheadedness, or things that for most people, fasting is at least a mildly uncomfortable experience. There are some people that feel amazing, and power to them. I've seen people, I'm like, how do you feel so good? Most people feel pretty tired and fatigued, right? So it's not something you sign up to do for fun, but being able to, kind of handle those symptoms in the context of what you're hoping to be achieved, at least psychologically, can be very beneficial too.
How do you recommend they complete that fast?
Absolutely. So, in terms of knowing how long to fast for, so a lot of people come into a fast and they're like, I want to do 21 days, or I want to do 30 days, or I want to do
Right.
X days. It's a really common thing I hear. And they're like, do you think I can do it? And I'm like, I honestly will have no idea until we're there. And I think that's a really important thing, with knowing when to complete the fast is just as important, if not more important, of how to complete the fast, because we really don't want to starve you. We don't want to wear the body down. We're working with the body to heal, not fighting against the body, right? So that's a lot of the observation part of it, the lab work, the vitals, the symptoms, the feeling, all of those things to know when to complete the fast. And I do recommend, it's fine to have a goal in your head, but to be very open and receptive if you don't make that goal, or even if things are going great, maybe extending that goal. And that all has to kind of be done on a day-to-day basis while fasting. When it's time to break the fast, typically we also have a pretty strict, what we call refeeding protocol afterwards. You do not want to just go and eat whatever afterwards. You're setting yourself up for high risk. And again, this protocol, the refeeding protocol, is a safety protocol. And this is even a medical thing. So for other reasons other than voluntary fasts, we do see people in medical settings that have either been, starved or had food taken away from them, or maybe have like a psychological disorder where they haven't been eating, or have had, prolonged surgery or prolonged kind of they've been trying to be like nil by mouth or something when you're in the medical system, and reintroducing food there has to be done very strictly as well. And it's because of electrolyte shifts, things like potassium, phosphorus, glucose can cause actual severe medical problems. So the same thing happens when we're reintroducing foods after fasting. So we typically start very light. We use things like broths and vegetable and fruit juices. The refeeding protocol usually goes for at least half the duration of the time you fasted. So if you did a 10-day fast, you're going to refeed for at least 5 days. 20-day fast, you're refeeding for at least 10 days, and sometimes even longer, depending on the person and their condition. There are certain people I have with autoimmune diseases or something like Crohn's or ulcerative colitis, where we're almost doing refeed protocols for a month or so to really make sure we're maximizing the benefit of the fast. Like I said, the fast is part of the healing. What you do afterwards is really, really important. And I would say the refeeding part is very, very essential. So yeah, typical protocols, again, it varies a little bit on the person and their conditions, but it's usually something light like juice or broth. Some people do blended vegetables, kind of depends on the person. Usually then transition, again, there's kind of two ways: salads, fruits, and vegetables, or some people do steamed vegetables. Then we slowly introduce more complex foods. So your complex carbohydrates, beans and legumes, nuts and seeds a little later, and then really tailoring that to the person. The type of lifestyle that I typically work with is predominantly whole food plant-based. And so that's the level that we get to. We typically keep it free of salt, oil, and sugar wherever possible. And that's kind of your final stage. And that's the one, you'll hear other people like Dr. Goldhammer will joke about it. If, you follow this for as long as you want to be well. And really that's the part of that we really try and touch on with the fast, is you have to maintain the lifestyle to maintain the results of the fast. Unfortunately, I wish it was that easy. I wish you could just come and fast and be healthy. But
Right.
Unfortunately, the reality is it doesn't work that way. And it's your transition to the healthy lifestyle and the really sticking to that will be most beneficial. And not always talked about with the refeeding protocol is also that reintroduction to physical activity again, right? So typically we can top up our glycogen stores again within a couple of days, rebalance out all the electrolytes. And most people are fine to start with kind of walking and things. I usually say to wait a week or two, depending on the person, getting your full strength back before going back into physical activity and easing into it, because obviously you've been resting for quite some time. And that depends on the duration of the fast, but some of the longer ones kind of want to ease back into physical activity slower, but definitely want to have a plan to get exercising again, because it's just so essential for your health.
Makes total sense. Wonderful. I have a resources question in that. I
Mm-hmm.
want to go ahead and touch on that now, because you had touched on that in the last question. What resource do you recommend for someone who wants to learn more about fasting?
Absolutely. There's a lot out there. Typically I usually just say, if you want to talk about things, feel free to come and schedule with me and I'll talk to you about it. Because I don't really follow, like, there's not one resource I can recommend, right? But anything that you find that comes across with documentaries or anything like that. I do like the book, The Pleasure Trap, that comes out of True North, who really has the biggest fasting center in the United States. There's quite a bit. Nathan Gershfeld has a lot of videos out there. That's who I work with at Fasting Escape. There's a book, Fasting Can Save Your Life, that's pretty interesting. Really just talking to people that have done it. The internet is a wonderful resource, and I'm not one of those people that doesn't like people to do their own research. Even if you find something that completely opposes what I might say or recommend, let's talk about it. Let's figure out what's happening underneath. What's the pathophysiology? Why did that person make those recommendations? I think it's really helpful to just get as many different opinions as possible and then bring them all together and think, okay, me as an individual and a person, what resonates with me and how do I think is going to be best for me in my fasting journey?
Okay, so what is a typical process that you go through with your customers to take care of them on their fasting journey?
Absolutely. So like I said, I work at Fasting Escape with Nathan Gershfeld. And so I'm the medical director there. And so I don't typically supervise the fast on a day-to-day basis. I do the medical pre-screening part of it. So someone will schedule an initial consult with me. They'll fill out a pretty extensive intake form. We'll go through all their medical history, medication, supplements, concerns, diet, medical history, family history, surgical history, allergies, anything you can really think of. We'll go through all of those things and try and make sure that someone is appropriate to fast. One of the things I do commonly for Fasting Escape is helping people discontinue medications if they're taking them and if they're medications that are appropriate to discontinue. So often we have to do intensive lifestyle change before they're able to fast, because we have to help get them off those medications. So really common ones there are diabetes medications, high blood pressure medications, and things like that, making sure we can get them off so they can even do a fast. Sometimes they have more in-depth questions that are more appropriate to ask me than to ask Dr. Gershfeld. So we try to spend time troubleshooting through all of those. And often the more kind of medically complex cases will come to me too. Once they're approved to fast, Dr. Gershfeld does the majority of the supervision. So that's daily check-ins, lab work, vitals, symptom check-in, how they're doing, how much water are they drinking, all of those things he
Mhm.
tends to do on a daily basis. Certain people might want to meet with me on like kind of a weekly basis, or if something's a little bit out of normal, I might kind of chime in and help out there. But typically he's doing that day-to-day work. And then once they've gone through the refeeding process, may want to follow up with me to make sure that, if we've taken them off medications, are they maintaining the results to be able to stay off them? Or is that something we need to keep working on medically? What are their results? Are we planning another fast? What are we planning kind of medically to help them feel, again, healthiest and happiest self? That kind of check in there for sure. And of course, during the fast, we provide as much education. We don't like to call it brainwashing, but as much education as possible to make sure that someone is committed to transition to the lifestyle, because that's what's going to be the long-term success. We don't want people saying, "Oh, I fasted and nothing got better." It's like, no, we need to set you up for long-term success with the lifestyle and things like that. So a lot of
Right.
education through that time period as well. I mean, you're supposed to be resting. Let's watch some DVDs on health and nutrition. Let's read some books. Let's read some journal articles and get people really set up for long-term success.
Perfect. So, what are misconceptions that you hear about fasting, and what do you say to address them?
The one that I thought that it was dangerous, that one's a big one. I thought everyone was just going to be like passed out and like half dead, but no, people do great through fasting. But I think that danger and fear is a really, really big one. I also think, especially, and that's why I wanted to clarify it in the very beginning, is fasting is not starving. They're completely different modalities. And I think a big part coming from a medical background is we try and do everything evidence based, right? Like I'm an allopathic doctor. I traditionally trained doctor. It has to be evidence based. And I think that people don't think that literature exists, but it truly does. And especially if you want to see it clinically work, that's somewhere where you go to the centers, or you see someone supervising a fast and you start to see, oh, this actually really works. And it's great because we can do it objectively. We can look at labs improving. Some of these things that are considered incurable conditions, especially let's talk autoimmune disease, we see these things resolve with fasting. People becoming what we call seronegative, or someone that has lupus is an example, ANA positive, all their labs are positive for lupus. We have seen people do fasting and they become seronegative. Their bloods look like they don't have lupus. Like that's considered, not possible in medical literature. So it's really trying to get out that education that it is evidence-based and it does clinically work as well. So, like I said, we really want to make sure that difference between fasting and starving is really made out clearly. And that's really looking, the best way that I kind of explain that is really going through what the body does when they're fasting versus starving, right? So we're using non-essential tissue and non-essential fuel. We don't want to get to the point where we're using essential tissue and using protein and breaking down our body and our muscle. That's when we see adverse events of starving. And unfortunately, they tend to be things like cardiovascular events or death. And that's what we 100% don't want to avoid. So when we're thinking about it, glucose wise, our brain needs about 100 grams of glucose per day, so 400 calories or so. Our body can produce about 25 grams of that from gluconeogenesis, and then we'll have breakdown of fatty tissue. So it's going to be, if we assume 100% assimilation, we need about 33 grams of fat per day. So that's, just over an ounce. Really not a lot. If you lost an ounce of fat per day, you wouldn't really notice, right? That breaks down to your ketones, beta hydroxy acid, acetoacetate, and amino acids. And that will spare the protein breakdown from the body. So that's what we're sparing from fasting. Those ketones produced in the liver, the acetyl-CoA generated beta oxidation of your fatty acids. That comes from your bloodstream, from the adipocytes, and that conversion of keto amino acids. We're talking your standard 154 70-kilogram male. Where did that come from? Male medical students who they used to test on. But we're talking about over 100,000 calories before protein is touched. A slim, healthy male has a lot of reserves. So, if we're eating 3,000 calories per day on that body weight, you've got 30 to 40 days of reserves in your body. And that ketone-free fatty acid and gluconeogenesis, that gives you about 30 days of survival as well. So that fear and that thought is not really there. But of course, that's the average person. Lots of things can go wrong, and that's why we monitor so closely. But I think addressing the danger is a huge part of it, and addressing the clinical effectiveness are the two major things that I focus on when someone isn't sure about fasting.
Perfect. Okay, so I definitely wanted to hear more. Hear you tell me about your most challenging client, and how you help them to reach success.
No one's challenging. I love people. No, it's a joke. It's been a running joke ever since I've been a doctor that I attract the most complicated cases ever, but I love it. I love getting that person that's like, no doctor knows what's wrong with me. I've tried everything, nothing works. I don't know what's happening, and I'm like, bring it on. Like, I want to figure it out. Like, that to me is what gets me going. Is what wakes me up, makes me want to do my job. So I would never consider anyone to be challenging. What I love is seeing things that were life limiting or really affecting someone's quality of life heal. And I also love seeing things that are medically impossible recover. So, like I said, my dad, medical miracle, right? Metastatic, what we'd call end stage cancer, healthy and well, living life, loving it. That to me is invaluable because this is someone that, expected to pass away in their 40s, now nearly 70, doing great. Like, that to me is just, you can't put a price on that. That's so valuable, and that's what I live for. Like, that's so, to be part of someone's journey to completely change their life is just, I don't know, it's next level. It's amazing. So a couple that come to my mind that I've seen, something like lupus, a really, really life impacting condition, I have seen that improve substantially. One that always sticks in my mind, a poor girl with the worst endometriosis I've ever seen. We're talking, so endometriosis being that severe menstrual pain because they have endometrial tissue in different places of the body. She would bleed from her umbilicus, nosebleeds. I don't know where her endometrial tissue seemed like it was everywhere. And I cannot imagine how painful that was. And she used to go to the ER every single month. And she's always given me approval to talk about her case because it's so amazing. Needing morphine, opioids, nothing would touch that pain. And it was miserable. And she'd have to take, 1 or 2 weeks off work every single month. And it was so hard. She had to start her own business because she couldn't hold down a job because no one wants you to take that much time off work. And it was just unbearable for her. And this was actually at True North. And she had her first menstrual period at True North while fasting, that she didn't have to go to the ER. And that, she was just crying with happiness because it was the first time that it was bearable for her. So that one just always stands out in my mind because I feel like chronic pain is just so impacting on people's life, psychologically, physiologically. You can't hold down a job. There's so many things that chronic pain takes away from people, that seeing that get better, amazing. PCOS is another one while we're on the menstrual disorder. People fall pregnant when they reverse their PCOS. And I've had people trying to fall pregnant 8-10 years, can't fall pregnant. That the psychological impact of that as well. And just the quality of life. Some people are just dying to have children. It's they feel that that's like what they wanted in life. They always wanted to be a mother and they just couldn't. And seeing that PCOS improve significantly to the point they can fall pregnant, having, when I was in the hospital, I used to deliver babies, and being able to deliver a baby of someone that couldn't fall pregnant and just seeing their happiness, amazing. I can go on and on and on. I don't know how many you want me to tell you about, but there's just so many people that it just makes me so happy. Like, I have literally a list of people that, like, if I'm ever having a bad day, I just look at it and think, oh wow, like, those people just inspire me to keep going and to do what I do and keep putting out information, because seeing them live a totally different life to they would have otherwise is just so incredible. And it's just I just feel like that's why, we're here on earth, help other people live as well as they can.
Yeah, I'm totally with you on that.
I'm way too excited about that.
Hey, no, it's okay.
I'm very passionate. I love what I do.
Okay, so for someone who wants to work with you, what is the best way to reach you?
Absolutely. I would say just schedule a consult. Happy to talk to everyone and anyone. You don't have to be interested in fasting. You might just be interested in improving your health, lifestyle medicine, questions, anything like that. But of course, fasting, bring your questions. We will talk and talk and talk until we get through all of them. I love to say no questions, unturned, nothing's too left field. At this point in my medical career, I can't say that I ever get shocked with things anymore. I think I've seen everything and heard everything. But if you think you've got something I haven't, bring it on. I'm down for that. But yeah, I would say schedule a consult. Feel free to reach out to me by email. I can't legally respond to medical questions and things like that via email. So I kind of just encourage scheduling a consult so we can do everything formally and I can really help out to the best of my ability. But email's always open as well. I'm happy to help out there. Connect with me on social media. I do intermittently some YouTube, Instagram, things like that. Happy to always kind of connect and help out with like-minded people. Absolutely.
Wonderful, wonderful. So that concludes the interview.
You got it.
Thank you very much for your time, help, expertise on this It has been amazing.